Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, health experts express concern over the optional face mask use in indoor settings. Some say it's premature to remove the layer of protection with the emergence of new XBC and XBB subvariants. And later, how is the government planning to expand the COVID-19 booster coverage in the country? Health Officer in Charge and Undersecretary Rosario Vergeire joins us in the program. Some health experts warn that making the use of face masks in indoor settings optional could lead to a new spike in COVID-19 cases. Some of them even questioned the timing and called the government's decision premature following the detection of new COVID-19 variants in the country. Also, how does the government plan to improve the COVID-19 booster coverage in the country? Let's go straight to the source of the story. We have Health Officer in Charge and Undersecretary Rosario Vergeire. Yusek Vergeire, welcome back to The Source. Maraming salamat po sa inyong oras.
Magandang umaga po, ma'am. Thank you.
Okay, so President Bongbong Marcos has allowed the voluntary use of masks indoors, according to Secretary Frasco. The decision was reached during a cabinet meeting a few days ago, wherein the IATF recommended this. What was the position of the Department of Health?
Yes, ma'am. We had an IATF meeting prior to this cabinet meeting kung saan po the Department of Health has presented our option or the optional scenarios, potential scenarios na pwede mangyari because of this proposal. But of course, this is a collegial body, ma'am, so we respect the decision of the IATF.
But what was the decision, the position rather, of the Department of Health?
Our position was that we take it that parang slowly, that we still do a pilot first during this month of November so that we can see if kakayanin po ng ating sistema. But the other sectors, of course, have proposed that we do it nationwide already and it be done already. So yun po yung naging decision sa IATF.
So when you say that your recommendation, the Department of Health's recommendation was to do a pilot first for the month of November, where sana? Saan ho sana yung pilot areas? Would this be NCR?
Yes, NCR was part of that because we had a criteria that we have proposed kung saan meron pong mataas yung booster shots, at saka kung saan po manageable yung system natin, may capacity po ang sistema natin. So NCR was part of this proposal.
So obviously, no, Yusek, na-overrule po yung position ng Department of Health.
Yes, ma'am. But as I've said, this is a collegial body, no? So we respect the decision of the IATF. Ang sa atin lang naman po, we were able to compromise and have that agreement na kapag, of course, healthcare facilities, public transport, we still require the mask. Tapos po, yun pong unified messaging that we will be continuously advocating to our citizens na in spite of this voluntary nature, dapat alam nila yung risk nila. This is going to be informed decision for all, that they will know when to remove the mask and they will know when they have to wear the mask.
And that's something that I'd like to discuss with you further a little later on, Yusek. Some doctors have actually aired their concern regarding this. Former Secretary Obial, Dr. Ronchin Solante, Dr. Tony Liachon, just to name a few. They were really, siguro, maybe just like the Department of Health, questioning the timing of this. But ito ho, sigurado na ho kasi hinihintay na lamang yung executive order from President Bongbong Marcos. Any idea when this will come out? Kasi let's make it clear, no? While the President has agreed to this, hindi pa po ito ini-implement.
Yes, ma'am. It's not implemented yet because the executive order has not been issued yet. But based on the cabinet agreements, it's going to be issued soon. So siguro po in the coming days, the executive order will be issued already.
So possibly by the month of November, mag-umpisa na po itong voluntary use of masks indoors.
Yes, ma'am, that is a possibility.
Okay. Because of this, Yusek, are you concerned that we will see a spike in cases? I know that you said that during the IATF meeting, you presented certain scenarios. If this is so, what kind of scenario are we seeing in the event na ipatupad na po ito sa buwan ng Nobyembre in terms of spike in cases?
Well, we have scientific projections that has been done by our experts. And based on these projections, if we have this loosening of the mask mandate, which is part of our minimum public health standards, maaari pong magkaroon tayo ng kaso from 2,500, which is a lower limit, and the higher limit is 18,000 towards December. Pero ang lagi din naman nating sinasabi sa ating mga kababayan, cases are expected to rise, not just because of lifting of mask mandate, but also because of the presence of the subvariants here in the country, plus of course the increased mobility across the population. So expectedly cases will increase, pero ang atin pong pangangalagaan at lagi natin titignan ay wag ma-overwhelm yung ating capacity ng ating healthcare system. And we have seen that, no? During these past months kung saan tumaas uli ang ating mga kaso, nakita natin that our healthcare system was able to accommodate these increases. So hopefully, we can see that we already have the tools compared to the past 2 years of the pandemic. We have the vaccines already. We have more prepared hospitals and facilities. Meron na rin po tayong mga gamot na ginagamit to prevent the progression of disease. So hopefully, tayo po ay magtuloy-tuloy na dito po sa ating pagbubukas na ekonomiya.
There are a number of factors really to consider here, aside from the number of cases. Let's say, for example, a spike in cases. Very important, as we've talked about over and over again, it's what you mentioned, the healthcare utilization. Dadami ba yung mga pasyente sa ospital? Ma-overwhelm ba yung mga ospital? And now you're saying that even with the spike, but although this spike has been not too high, hindi naman po na-overwhelm yung ating mga ospital. But Yusek, now that XBB and XBC variants are here, subvariants are here, is this a possible cause for concern? Kasi sinasabi nga, it is immune evasive.
Well, actually, ma'am, we have seen already the impact of this XBB and XBC across the population. During the time that we had our increase in the number of cases, ito pong XBB at XBC we started detecting already. And we had been seeing that more and more these people who become sick are already fully vaccinated and some have boosters already. So nakita na natin yung evasive nature nitong subvariants na to. Nakita natin it has also caused the increase in the number of cases in these past months. At nakita natin that our hospital capacity was able to accommodate naman. We were able to manage. So hopefully tuloy-tuloy lang po. Wag lang nga sana na maging masyado tayong complacent. Kailangan pa rin magpabakuna po tayo, especially our senior citizens, para ma-preserve po natin yung ating severe and critical na hindi tatamaan lalong-lalo na yung vulnerable natin.
Was there a parameter set that kapag umabot tayo at a certain number of cases and a certain percentage ng healthcare utilization with the relaxing of the mask mandate, that ibabalik po yung pagsusuot ng face masks indoors?
Yes, that would always be the default. Actually, even in our alert level system that we are still currently using, yan po yung atin. Kapag umabot tayo ng alert level 3, magkakaroon na po tayo ng pagbabago sa ating mga restrictions. And this alert level 3, mapupunta tayo dyan kapag nag-moderate risk classification na tayo sa kaso, pati na rin po dun sa admissions natin sa hospital. So meron po tayong warning system, meron tayong alert level system that we use so that we can be able to properly monitor and we can be able to revert to the usual or the previous na magmamask tayo uli o di kaya baka magkakaroon pa tayo ng further restrictions kung sakasakali.
And to refresh our memory, Yusek, ano ho ulit ang alert level 3? Kasi basically, you're saying pag umabot po tayo, we have a warning system. We have alert level systems that are in place. Sabi niyo po, pag alert level 3, posibleng we become strict again with mask mandates and other factors. What is alert level 3 again in terms of cases, positivity rate, and healthcare utilization?
Yes, ma'am. In our alert level system, we use our cases and also our healthcare utilization. So kapag ka nag-high risk na po yung case classification, ibig sabihin tumaas na po ang ating average daily attack rate, at saka pagka yung ating healthcare utilization tumaas na by 50%, ayan na po ay isang trigger para sa atin or warning that we need to elevate or increase or itaas po natin ang alert level natin to alert level 3.
Okay. Now that at very soon this indoor mask mandate will be voluntary, it's good to tell the public and remind all of us what should we consider and what should we do. But we need to take a very short break. We will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, OIC and Undersecretary Maria Rosario Vergeire. Let's give a big picture, overall picture, so that we all understand how it will be like moving forward to a voluntary mask mandate indoors. So, pag na-issue na po itong executive order, Undersecretary, ano ho ba dapat nating maalala? Saan muna siguro kailangan pa rin gamitin ang mask, because we're already hearing reports that medical facilities, public transportation, and there was another one.
Yes, ma'am. Is the medical facilities, the healthcare facilities, and the public transport wherein masks are still required. Yun pong ating mga vulnerable, katulad po ng mga nakakatanda, yun pong mga may sakit, yun pong mga buntis, yun pong mga hindi bakunado, ay kailangan pa rin pong mag-mask sila. Highly encouraged for them to wear the mask. But otherwise, everything is voluntary. So kailangan lamang po alam ng isang individual their risk level. Yun pong kanilang risk dapat alam nila. So halimbawa, nagpunta sila sa isang lugar na matao, alam nila that is high risk for them, especially if they are old or if they have these comorbidities, kailangan nakamask pa rin po sila. It is really the importance of the message kung kailan sila dapat magtanggal ng mask at kailan sila dapat nakamask ay importante.
Parang naka-ano na po sa atin sa sarili nating assessment kung ano ang dapat nating gawin. But aside from the yung inyong problems, yung inyong kahinaan sa katawan, kung ikay senior citizen, if you have comorbidities, I think, Yusek, it's also very important to underscore the fact that hindi lang sa atin, kung hindi, anong magiging epekto nito doon sa mga uuwian natin sa ating mga bahay. For example, of course, andun po yung nanay, tatay, lolo natin, senior citizens. Maaaring madala kasi natin yung sakit sa bahay. So that's something that we also need to remember.
Yes, that's true, ma'am. Kaya lagi namin sinasabi, this is a shared responsibility. Kung sa tingin natin, tayo mismo, malakas ang katawan natin, hindi natin kailangan mag-mask, kailangan iniisip din natin, tayo, pwede natin maproteksyonan ng sarili natin or hindi tayo magkasakit. Pero when you get home and you go home to your mommy and your daddy, your lolo and your lola, and even to children, yung mga maliliit na bata, pag umuwi ka dyan and you expose them, they are vulnerable and they can get sick.
Okay. Any update on the XBB and XBC cases? Last I saw, there was about 81 XBB and about 193 or 197 XBC. Umakyat na ho ba ito?
Yes, ma'am. So ngayon po yung XBC, we find that in 11 of our regions already. At ito po namang XBB, we find it in 2 of our regions. Currently, ang XBC cases po natin at 294 na po siya. Ang XBB naman po is 193 cases. But if you look at the entire picture of our subvariants in the country, this only contributes to around less than 1% of the different subvariants present in the country.
I see. Okay. But there's a concern, no, Yusek, with is it the XBC or the XBB around the world? Which one is it? And which one is more transmissible or maybe possibly even virulent?
Actually, both of these subvariants are had been reported to be more transmissible than the BA.5 subvariant of Omicron.
Mm.
The BA.5 subvariant of Omicron was the subvariant previously circulating in the country and most
Opo.
predominant. Ngayon po, ito po sinasabi, mas transmissible siya and the immune evasiveness of these two subvariants is really high. Kaya nga nakikita natin ngayon sa mga kaso natin, in the cases that we have seen, nakikita natin most of them are fully vaccinated even with boosters, but they are still getting sick.
But would it be, I wanted to find out from you, I'm sure you're up to date with this, would it be more, kasi it has an immune escape consideration, hindi ba? They're saying, is it the XBB or the XBC? I wanted to ask you, is it because siguro nag-lapse na rin po, Yusek, yung ating primary at booster, nakalampas na po, nahigitan na yung 6 na buwan, hindi ba? They say that after 6 months, medyo bumababa na po yung ating immunity dito. Is it because of that? Because parang, kumbaga, napapaso na yung ating booster shots?
Well, it can be both, no? Sa unang-una, we know that the effectiveness of our primary series begins to wane after some time. Kaya we are requiring the first boosters already. But also because of the immune evasiveness of these subvariants, they escape immunity. So even though you receive your boosters, nawawalang visa, no? Mas nagkakaroon ka ng sakit because na-evade niya yung immunity. So this aggravates the fact that our immunity has already waned in the population, pumasok pa yung subvariant natin na nakaka-evade ng immunity na meron tayo sa ngayon.
So gaano ho ka-importante itong bivalent vaccines? Because there could be this notion right now that hindi na lang ako magpapa-booster dahil sinasabi nila immune evasive, but it's been said over and over again, time and time again, na pwede ka talagang magka-COVID. Ang maganda lang kasi dito, hindi ka pupunta doon sa severe at critical kapag nakakuha ka ng bakuna.
Yes, ma'am. Actually, hanggang sa ngayon naman, our experts are saying that with the primary series that we have received, the first 2 doses, meron pa rin kahit kaunti na epekto yan to prevent us from getting severe and critical infections. Pero kailangan nating i-boost yan, the first booster shot, para mas tumaas pa uli yung protection against severe and critical. Now comes the bivalent vaccines, which is already available in some countries. Ito pong bivalent vaccines was designed to address specifically ito pong Omicron variant. Kasi itong Omicron variant became the predominant variant already across the globe. And gusto nila ma-address ito so that we can further prevent severe and critical infections. So this bivalent vaccine, ma'am, there are articles saying right now, no, although the evidence is not that complete yet, pero sinasabi niya, konti lang yung advantage niya over dito sa ibang vaccines or the current vaccines that we have right now. But of course, we like to look at the real-world studies kung saan nabigay na siya talaga sa population at makita natin kung talagang may effect ito o wala. So the Philippine government now is currently being proactive kung saan we are already negotiating for these bivalent vaccines with the manufacturers, and hopefully magkakaroon din po tayo by the early part of next year.
So next year pa ho, because there were reports that possibly by November, magkakaroon na po tayo ng bivalent vaccine. So that's not true. Huwag po tayo umasa doon.
Well, there is this commitment from the manufacturer na maari sila makapagbigay as early as maybe December. Pero syempre, meron ho tayong mga ginagawa pang mga arrangements so that we can do that. Of course, the Philippine government would like that as early as possible here in the country. But this has to go through our regulatory processes pa rin po kasi. That's why we do not like to have the expectations that high. We're saying it's the first quarter of next year. Pero kung dumating ng December, syempre po, magipapatupad tayo as long as we have cleared it with the FDA and our Health Technology Assessment Council.
Best case scenario then is that makarating siya ng December, but to manage expectations, we're looking at, the Department of Health is looking at the first quarter of next year. All right. Yusek, we also need to talk about new requirements. Are there going to be new requirements for incoming passengers? And of course, the state of our nurses and our doctors, our healthcare workers. We'll just take another break. We will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Health OIC and Undersecretary Maria Rosario Vergeire. Are there new requirements or are there requirements na natanggal po for incoming passengers?
Yes, ma'am. In the previous IATF resolutions and the protocols that we implement, if a foreign national do not have any vaccination or partially vaccinated lang siya, or hindi ma-verify ang kanyang vaccination status, they are not allowed to enter. Pero ngayon po, meron na tayong bagong protocol as agreed with the IATF na kapag ka po kayo ay foreign national, no need for pre-departure testing kung kayo ay fully vaccinated. Kapag kayo ay partially vaccinated or unvaccinated, papapasukin pa rin kayo but you need a pre-departure test within 24 hours na antigen test.
Not anymore RT-PCR, just an antigen test 24 hours before. If not vaccinated or simply partially vaccinated. Anything else na nadagdag o natanggal?
Wala na po. Yun naman po yung major concern talaga ng ating mga travelers, especially foreign nationals, because prior to this IATF resolution, they were not allowed to enter if they did not have any vaccination or partially vaccinated. And another thing na kinocomplain nga yung ating pre-departure testing, which we have removed already for fully vaccinated individuals.
Opo. And of course, nabalita na po yung One Healthcare Pass that becomes a little complicated for some of the passengers, no? Ang pinalitan na po ito, hindi ho ba ng e-card, which is just more simple.
Yes, ma'am. Actually, this has been also discussed in the IATF and the Department of Tourism, the Department of Transportation, and the Bureau of Quarantine of the DOH have sat down and discussed paano natin mas streamline, mapadali, mas maging convenient sa atin mga passengers. So ngayon po, e-card na po ang ginagamit natin and our passengers are not required to have this before they board. Pwede hong pagdating nila dito, kung hindi nila magawa yan prior to their departure, there is a special lane in our airports to do that. So hindi ho kailangan maging inconvenient na para to sa ating mga passengers ngayon.
Mas simple nga po at mas konti yung datos na hinihingi apparently with this e-card compared to the One Healthcare Pass. But I understand, Yusek, that this e-card pwede rin kunin ata doon sa website ng One Health Card. Tama ho ba?
Yes, ma'am. The website itself, no, yun pa rin. You do your e-card para po hindi na kayo kailangan pumila pa pagdating nyo sa airport. You can do that before you depart from your origin para when you get here, tuloy-tuloy na po yung process nyo. Pero ang sinasabi lang natin, if and when, for those people who had not been informed or for those people who were not able to do this, there is still a special lane that can accommodate them pagdating po nila dito sa airport.
On another topic, Undersecretary, ito po yung 100 children, about 100 children in Batangas. They were infected with this foot and mouth disease. Tama ho ba? Nalaman na ho ba yung source of infection ito? And what is the behavior of this? Hindi ho ba, would this be different? Diba? Kasi ang alam po natin, ini-infect po nito yung mga hayop.
Yes, ma'am. The hand, foot, mouth disease, HFMD. This is caused by a virus, the enterovirus family, kung saan it usually affects our children. Ito po ay dati pang nagkakaroon tayo since 2012, nagkaroon na po ng pag-aaral at nakita na that it is endemic here in the country. Ngayon po, nagkaroon tayo ng clustering of cases in certain parts of the country. Here in Batangas, they identified 352 suspected cases. Pero nung verify po ng Department of Health yan, less than 50 lang po talaga ang kumpirmado clinically with this kind of disease. And then when we subjected to laboratory, ang nakuha ho namin ay dalawa pa lang po na positibo dito sa virus ng Coxsackie, which is the source of this infection or the cause of this infection.
So ang konti lang po pala in terms of reconfirming ilan ang nagkaroon ng hand, foot, and mouth disease. Tama po?
Yes, ma'am, because initially they have reported around 300 plus suspected cases. Kasi clinically naman makikita mo yan kung may mga lesions yung mga bata sa kamay, minsan sa bibig, tapos naglagnat. Pero yung iba naman po ay na-exclude natin when we tried to evaluate at ni-review natin yung kanilang mga records, sinignan natin ng mga bata.
And kung hindi po hand, foot, and mouth, kasi pareho po yung mga symptoms, yung lesions, nagkaroon po ng sakit, what was it?
Because many of them, that's why they were eliminated or excluded from the list, hindi po sila naglagnat. One of the common symptoms of hand, foot, mouth disease, bago ka maglabasan ng lesions, nilalagnat ka muna. So this was one of the factors why we were able to shorten the list. No? So ito pong mga batang may mga lesions sa kamay, maaring meron lang bacterial skin infections, maaring meron lang pong mga galis aso that we call yung scabies po. Kaya po nagkakaroon ng lesions but not necessarily the hand, foot, mouth disease.
Ang hirap din po talaga i-differentiate, no, Yusek, which you have. I mean, one could easily think kasi pag may lesions na po, medyo baka kabahan na po yung mga magulang, tapos nagkalagnat po. Tapos lumalabas nga ngayon itong, well, hand and foot, although you're saying that it's already endemic naman po. Pero one cannot really determine immediately kung ano po ang kanilang sakit.
Tama po yan, ma'am, no? Kasi syempre, magpapalaboratory pa po tayo and it also takes time before laboratory results come out. Kaya ang pinaka-importante talaga, we have that high index of suspicion. Tama po yung ginawa ng Batangas healthcare workers. Nag-identify sila ng mga suspects, na-isolate nila yung mga bata, tinuruan ng preventive measures yung the rest of the children in the community and in the schools para lagi tayo dapat na naandun na kung hindi man siya maging hand, foot, mouth disease, nagawa mo yung dapat nating gawin.
That's right. Okay. Health OIC and Undersecretary Maria Rosario Vergeire. Ma'am, thank you so much for your time.
Maraming salamat po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.